Dr. Vuong, let's talk sedation dentistry, the type of dentistry where people basically sleep through it, but they're not knocked out like the way they when they get appendix operation. They just don't, they just don't. Time is flying, and I think you're doing that in your practice, aren't you?
Yes, definitely. Nowadays, I find a lot of patients that are very anxious and fearful of the dentist. And for those patients, I always offer...
Nowadays! That has been ever since.
I guess it's been ever since the beginning of time.
I have a few years on you, and I know I was worried about a dentist before you were born.
That's probably true. That's probably true.
In fact, I would actually bet the fact that the reason people are still afraid of a dentist comes from the time before, like when I was a kid, when the dentist who examined me, I remember the way he examined whether a tooth had something wrong. He took his mirror, turned it around, that big metal stick, and he poked every tooth. And on the tooth where I went, he said, that's the one. Examination complete. and then the needle he stuck on it, that was like a pipe. I mean, it was like a pencil, not like something beautiful then. Anyway, I think the fear comes from past experience carried on from literally our parents and grandparents still. So anyway, back to sedation dentistry.
So yeah, so because of all the patients that are fearful and anxious, they tend not to seek dental care and they avoid coming to the dentist. So we try to make it easier on our patients by offering sedation dentistry.
How does it work? How does it work? What's happening there? What makes the person being basically out of it, but yet still responding to your commands, basically still being able to have a conversation with you while yet not knowing that he has the conversation? How does that work?
Well, that's the wonders of modern medicine. We use a simple pill that the patient takes about an hour before the appointment. It kind of relaxes them and allows them to overcome their anxiety and fears about dentistry. And
they shouldn't. Should they drive with that pill to the dentist? No, not anymore, right?
No, definitely not.
Okay.
For patients that are going to do sedation dentistry, they're required to have a friend or relative drive them to the office and drive them home and take care of them. Because they're under the medicine, they're going to be real drowsy and sedated and sleepy and pretty much not care as much as before about the dental work.
Right.
That's why it makes it easier for them.
Got it. Now, so a person basically is on one hand completely alert, and on the other hand, time flies, right?
That's right.
In fact, go ahead.
They're alert enough to actually respond to our commands, but they're not fearful. They're not really alert enough to be fearful. They're just kind of like they're drunk. That's the effect.
All right. Well, maybe that gets a lot of people in. Are there any side effects?
The side effect is...
Besides not being able to drive and stuff, but long-term side effects. Is there any
side effects? No, absolutely not. I haven't seen any long-term side effects. Most of the side effects is just fatigue and drowsiness, and that wears off within the day.
So I've heard that when people finish a treatment for 5, 6, 7 hours sometimes, so basically there is the fact that people who are very afraid, they can and should do this, but then there's also the people who maybe don't necessarily mind, but what they don't want is go to a dentist 6 times to fix a whole big restoration. So they go in at 10 o'clock, they walk up at 3 o'clock, and they walk out with their mouth basically being 100% new. Is that true?
That is true. For patients that are doing sedation dentistry, we try to get as much dentistry done all in one sitting.
Right.
That way they don't have to spend 6, 7 trips at the dentist, and we just try to we kind of convert 6 to 7 visits in a dental office into just one big long visit.
Right, because the fact is every dental visit, especially if you do, crown bridge implants, periodontal disease, root canals, wisdom teeth, and whatever it might be, any combination of it, half a day is gone, it's finished. Even if your visit only lasts an hour, but they're coming in, they're getting out, you no matter what, you have a little bit of a numb mouth afterwards, and depends what profession you have. By the time you get back to work, a half a day is gone, an afternoon or a morning is gone. And so there's lots of time saved doing that.
That's right. We do have a lot of patients that have to work every day, and they don't have the time off to take off from work. And sedation dentistry is really a great option for people that can't take off work.
So get lots of work done, and there we are.
Yeah.
And because I know when I sit at a dentist for an hour and a half, let's just say do some deep scale cleaning and whatever it is, no, it doesn't hurt, but it's awful boring to sit there. You get itchy. I mean, a guy like me anyway, I'm probably too much overhyper, but you sit, you start counting sheeps, and so imagine if you sit for a long work. So by this I heard people walk out and they kind of they say, well, so doc, when are we going to start dentistry? And everybody smiles and go, you're done. You got 4 crowns, 2 root canals, 9 implants, and we're done. Is that true?
That's true. Now, one of the beauties about sedation dentistry is afterwards, the patients tend not to remember the appointment. They don't even remember that they really came in. The only part they really remember is actually maybe coming in and saying hi, and that's about it. They don't remember any of the dental work at all.
Wow. Well, of course, if that happens to me, okay, I ain't going to pay a bill. I don't remember having something done on me. Okay? I just want to let you know, okay? I'm not going to pay anything I don't remember having happened with me, okay?
But you'll have the new crowns. You'll have the new crowns. I
don't care. I don't know how we got there. I'm sorry. I don't remember nothing. This transaction did not exist. Oh my God. It's like I used to be in the hotel business for a while, and, we made the jokes, when we put somebody, mushrooms in the dish somehow, some type of mushrooms in Europe, and the person looks at it and says, oh, that looks good. I said, yeah, and that's whatever, let's say $18. He goes, well, yeah, we pay afterwards. I go, no, you got mushroom, you pay now. We don't know where you survive them. I guess that's what you do with sedation dentistry, right? All right. It looks like a great thing. And how come is it that not every dentist has that?
Not every dentist has that because they're not trained. They don't feel comfortable with sedation dentistry. In fact,
you even have an anesthesiologist, if I pronounce that right, on board. Am I right there?
That's right. We work with an anesthesiologist to do even deeper sedation. For a lot of young kids that can't tolerate dental work, we actually put them all the way to sleep to get all their work done in one visit.
So good for kids who because I know some pediatricians that really have a hard time working with the kid simply because, well, the kid isn't going to sit still sometimes.
That's right. So a lot of kids
works for that too.
The ones that are young enough that they can't cooperate. They don't want to cooperate due to fear or just due to fear, just the unknown. The sedation dentistry is really great for those kids. We get everything all done at one visit. Parents are happy. They don't have to bring their kids in 10 times. One stop, one visit, everything's all done.
Beautiful. Thank you very much, Dr. Vuong. Thank you very much. Very candid, very informative, like always. Bye-bye.
Thank you.